Hello, good day everyone, and welcome back to my channel. To my returning subscribers, this is me saying thank you for sticking around. And if you are new here, my name is Mesoma Nabrini and I discuss everything health. Today I'll be talking about labor and what to expect during labor. So let's go into what labor is. So labor is a process of progressive, intermittent, painful, regular uterine contraction, which leads to effacement of the cervix and its dilatation, and then delivery of the product of conception. So I know you'll be wondering what effacement is. This is the thinning and the shortening of the cervix. If you want to know what the cervix is, I made a video on the female reproductive system. I'll drop the link in the description box as well for you to just watch what the female reproductive system is. From there, you should be able to know what the cervix is. Okay, then I know you also be wondering what contraction is. This is a term used to describe the tightening and relaxation of muscles. So in this context, this is when the muscle of the uterus tightens and relaxes, and this contraction helps to push the baby out of the uterus. Then what is product of conception? Product of conception is the baby and the placenta. Okay. So that leads us to what to expect during labor. So basically, if you're in labor, your health care provider, which can either be a midwife or an obstetrician, is going to perform a physical examination on you. And this physical examination may include examination of the abdomen, and this is basically to determine the position of the fetus, and also examination of the cervix for dilatation. Dilatation here just means how wide the cervix is, and it comes in various cm. We'll talk about that in the stages of childbirth. Okay. And also varieties of checks will also be carried out. This includes vital signs. And what is the content of vital signs? Checking your temperature, your pulse, respiration, your blood pressure. This is what vital sign is made up of. Then also blood and urine samples are also taken. The intensity and frequency of your contraction is checked, and also the fetal heart rate is checked as well. Then you will need to be cannulated in order to receive IV fluids and other medications during labor. So what I mean by cannulated is just having an IV line to help you receive medications or IV fluid. Next is pain alleviation. Your pain management is determined by your health, your own personal preference, the baby's health, or your healthcare provider's recommendations. So this pain management is divided into the non-medical pain management and the medical pain management. So what is the content of this non-medical pain management? This includes the presence of your partner. That's left for you to make. If you want your partner to be present, then good and fine. If not, it's up to you. That's why your preference is always noted. Then the next one is touch. This touch can be given to you by your partner or any other person that you want. Then you can also receive hot or cold therapy. Then meditation and breathing exercise are beneficial as well for pain alleviation. Then positioning and movement. And this leads us to the medicated pain management. This includes the use of analgesics. This basically drugs that helps to relieve pain. This can be given orally, epidural, or through inhalation. Orally is through the mouth. Epidural, this is injected into the epidural space of your spine. Then inhalation, just you inhale the medication. Comes in gas form. Example is Entonox. Then this leads us to the signs of labor. So how will you know you are currently having labor? So if you are experiencing strong and regular contractions, my friend, you are most likely in labor. Secondly, if you're having abdominal or lower back pain, and this pain is as a result of the contraction, then if you've had like what we call rupture of the amniotic sac, basically layman's understanding, they say is water break, then you are in labor. But just note that this water or this amniotic sac can be broken before labor, that's spontaneously, or during labor, or can also be broken by your health care provider before you deliver the baby. Then the last but not the least is passing of show. This is a sticky pink or slightly blood discharge that comes out of your vagina, okay? Then we'll move over to the stages of labor. So labor is divided into 3 stages. You have first stage, second stage, and third stage. So the first stage is dilatation. So let's look at what happens in this first stage. So during this stage of labor, the cervix begins to thin and dilate due to the uterine contractions and the presence of prostaglandins hormone released during labor. So in this first stage, it has 2 phases. You have the latent phase and the active phase. So let's go into them individually. So what happens during the latent phase? This is the onset of labor. So basically, it's when the cervix is still 0 cm to 4 cm dilated, and the length of this stage can vary based on individual differences, but it takes up to 20 hours in first-time mom. So it takes longer in first-time mothers. So let's move over to the active phase. As the name implies, active phase, so a lot goes on here. So in this phase, the cervix dilates from 4 cm to 10 cm. In this phase, contraction becomes stronger and more painful, and it tends to occur every 2 to 3 minutes without much muscle relaxation in between the contraction, and it ends with the delivery of the baby. So basically, the cervix is said to be fully opened or dilated when the cervix is 10 centimeter dilated, and this is the diameter needed for vaginal delivery to occur. This phase may last between 30 minutes to 1 hour. It also takes longer time in first-time mom. So let's go over to the third stage, which is delivery of the placenta. This stage involves the delivery of the placenta out of the uterus through the vagina. So what is the placenta? This is the organ that nurtured the baby inside the uterus. This stage can take up to 30 minutes, but note, if it's beyond 30 minutes, it is called retained placenta, which is a problem on its own. Thank you. We've come to today's end. This is me saying thank you once more to all my returning subscribers. Please don't forget to click on the subscribe button and the notification bell to get notified on when next I post a new video. And please don't forget, your comment is very vital. Drop your questions, anything you want me to discuss, maybe topic or any random things. I'll be in the comment section as soon as I can. Thank you and see you next time. Bye bye.